So our next topic are the establishment of proviruses. Most viruses, things like influenza, COVID, they go in, they infect a cell, and they're short term. So they go in, they do damage within the cell, they replicate within the cell, and then they leave the cell, eventually go on and infect more cells, but the entirety of the infection lasts only several days to several weeks. So it's an acute infection. There are some viruses that are able to establish chronic infections and last a substantially longer period of time, potentially even the remainder of their life. So infections that are able to establish, or viruses that are able to establish a chronic state of infection often engage in the formation of something known as a provirus. By that, I mean they take their genetic material. These viruses are typically DNA viruses, but not always. They take their genetic material and they insert it into the genome of the host cell. And by doing so, every time that host cell divides and produces more of itself, it is going to have a copy of the viral genetic material. And in that way, the virus is always within the host. It has a chronic state, and essentially you're not able to get rid of the infection. This is standard for something like HIV and many of the different herpes viruses. So in regards to HIV, when the HIV virus infects a host cell, which for the HIV virus, the host cell that it would typically infect would be a specific type of T cell called a helper T cell. But when the virus infects the helper T cell, it actually uses an enzyme called reverse transcriptase to revert its RNA into DNA. And then that HIV DNA inserts itself into the genome of the T cell. So then as the host produces additional T cells, those T cells will contain the HIV genetic material. And for that reason, HIV treatment is non-curative. You can control how much of the virus is in the blood by taking antiviral medications to keep the viral titers low and the patient's immune system strong, but you can never really get rid of the infection because the virus is embedded into the DNA of the host T cells. So while you can control it, you can't cure it because it is within the DNA. And that is an example of a provirus. When a virus infects a host cell, embeds itself into the DNA of the host cell, and establishes a chronic, often permanent infection. Like I said, they can be controlled through medication, but not cured. Another example of this kind of what we call kind of dormancy is common with herpes viruses. So with herpes viruses, once you become infected with the herpes virus, you do have that infection for a lifetime. That doesn't always mean it's going to be active and you're going to have signs or symptoms. But with the herpes viruses, once they infect you, they do embed their DNA within the DNA of certain cells in your body, specifically nerve cells, and they remain there for a lifetime where they could be dormant and not cause any problems, but more often than not they do. And when they cause problems, it's usually when you're immunocompromised. So the herpes viruses, when your immune system drops below a critical point, they see an opportunity to come back out, and they will typically cause some type of active infection. It depends on what type of herpes virus we're talking about. Obviously, there's things like genital herpes, which are going to cause lesions in the genital region. There's herpes simplex, which is going to cause lesions around the mouth. But what those all have in common is that once you're infected with for a lifetime, and you will have periods where the infection's dormant and contained within the nerve cells, and then periods where you're potentially immunocompromised from stress or, another infection or diabetes or cancer or pregnancy or whatever, something that could stress your body and make you immunocompromised. the virus at that point would see the opportunity to come back out and cause subsequent infections throughout life. I mean, definitely there's medications that you can take to control the infection or lessen the signs and symptoms, but typically once you're infected, it is embedded into the DNA of those specific host cells, and it can be problematic for a lifetime. One of the prime examples is the varicella-zoster virus. So the varicella-zoster virus is a herpes virus. The first time you become infected with it, you get a disease known as chickenpox, which used to be very common when I was younger. Children don't get it nearly as much now because there was a vaccine that was created in 1995. But if you were born before the creation of the vaccine, you likely experienced chickenpox. But that means you were infected with the varicella-zoster virus. You got these itchy lesions all over your body that lasted for a few days to a few weeks, and then you made a full recovery, no permanent scarring, no complications. It wasn't a life-threatening illness. And from, that perspective of being a child with chickenpox, you think that that's it. You don't ever have to worry about that again. But the varicella-zoster virus is still in your body. It gets in there and it causes chickenpox, and it doesn't go away. It actually goes into the nerve cells, embeds its DNA into the DNA of the nerve cells, and remains dormant there. And in some people, it honestly will stay dormant for the rest of their life, and it'll never progress into anything more serious. But in other individuals, a lot of other individuals, when they get immunocompromised later in life, potentially just from age, but it could be stress or some other condition, when they become immunocompromised, the virus sees an opportunity to come back out. And what it is going to do is it was going to come out, and it's going to, because it's in the nerves, cause lesions along the nerve pathway. And that is going to lead to a disease that we know as shingles, which is incredibly painful. Chickenpox is kind of an itchy annoyance, but shingles, while it is itchy, it is incredibly, incredibly painful, and it can potentially last weeks to months. And since the virus never actually leaves the nerves, every single time you get immunocompromised, that virus can come back out along the nerve pathway and cause a shingles outbreak to happen. So chickenpox is one and done. You get infected with varicella-zoster, you get chickenpox. Varicella-zoster goes virus and embeds itself into, varicella-zoster virus goes dormant, embeds itself into the nerves, and then waits for you to become immunocompromised. When you do, it comes back out along the nerve pathway, and you get shingles for a period of time. And then, if you ever get immunocompromised again, it comes back out again. So you can get shingles a lot throughout your life. Now, there's definitely medications that you can get to help prevent it from happening and lessen the symptoms. But it is problematic. So if you're someone like me that had chickenpox when you were younger, we got to keep up on the booster vaccines, especially when you get over the age of 50, to lessen the odds that you're going to get shingles. For those of you that have never had chickenpox because you were vaccinated, you're still going to need boosters later on in life, because if your immunity would wear off, you could potentially get chickenpox, which means the virus would be able to establish dormancy and eventually could lead to shingles. As it isn't bad enough, some viruses can even cause cancer. So viruses that are able to cause cancer are called oncoviruses. So oncology is the study of cancer. So viruses that are able to cause cancer are called oncoviruses. There's a lot of different viruses that can lead to cancer. HPV, which is the human papillomavirus, has been linked to cervical cancer. Not all strains of HPV, specifically strains 16 and 18, have been linked to cervical cancer. The Epstein-Barr virus, which causes the disease that we know as mono, has been linked to a form of immune system cancer, specifically cancer of the B cells, Burkitt's lymphoma. And then hepatitis B virus and the hepatitis C virus have both been linked to liver cancer. So unfortunately, there are some viruses that are able to induce cells to grow and divide rapidly, which are cells that are cancerous. So those viruses would be classified as oncoviruses. So our next big topic are bacteriophages. So I need you to somehow make a mental divide between animal viruses, which are viruses that infect animal cells such as human cells. That's everything that we talked about before. And now we're switching gears to bacteriophages, which are viruses that infect and destroy bacteria. So you need to have that mental divide because there are some differences. So here in this image, we are looking at a bacteriophage. So this is a virus that is able to infect and potentially destroy bacteria. The bacteriophage has a complex structure because it has multiple shapes that dictate its overall structure. It does have this icosahedral head, so this diamond-like head. In here, you can't see it, but in here would be the virus's genetic material. For bacteriophages, it's typically DNA. So there would be DNA inside here, and then this would be the capsid kind of surrounding and protecting the genetic material here in the icosahedral head. And then down here we have this helical neck region, which makes up another shape, the helical shape. And then down here we have these little things that we call tail fibers. The tail fibers, these kind of like little legs here, these are like the equivalent of spikes for a bacteriophage. So these are what they are going to use to attach to receptors on the bacterial cell that they are in fact infecting. So they do have various different components and shapes that make up their overall structure. With bacteriophages, they can actually engage in two different life cycles, the lytic life cycle and then the temperate life cycle. Now, the lytic life cycle, I want you to think of this as the good life cycle. In the lytic life cycle, a bacteriophage would infect and destroy a bacterium, which is good, right? Because potentially we could take bacteriophages one day as a form of medication, similar to antibiotics, where they would destroy bacteria. So with bacteriophages that enter a lytic life cycle, that would be something opportunistic for us. It would be a good thing. They would be able to infect and destroy bacteria. What we worry about, though, with bacteriophages is this thing called a temperate life cycle. In a temperate life cycle, the bacteriophage would infect the bacteria, but it would not kill the bacteria. Instead, it could potentially make the bacteria stronger, which is definitely not something we want to do if we're trying to treat someone with bacteriophages to get rid of their infection. We don't want to actually make the bacteria stronger and make the infection worse. So we really haven't started using bacteriophages yet as far as like antimicrobial agents, because it is a fine line. You know, you pick the right bacteriophage and it enters the lytic life cycle and destroys the bacteria, which is what we want. Pick the wrong bacteriophage and it goes into a temperate life cycle and infects the bacteria and makes the bacteria stronger and the infection worse. So I do want you to kind of think of the lytic life cycle as something good and the temperate life cycle as ultimately being something bad.